global prevalence of periodontitis in adults remains high, and peri-implant diseases represent an emerging healthcare burden. There is therefore a need to refocus oral health priorities upon primary prevention of periodontitis by managing gingivitis and peri-implant mucositis, and upon secondary prevention aimed at preventing disease recurrence in previously treated periodontitis patients. Here are some recommendations for an effective prevention of periodontal diseases and to prevent periodontitis. Mechanical plaque control should be the focus of preventive periodontal therapy, but should be personalised to individual patients. Therefore, necessary prerequisites include diagnosis, risk assessment, subject and site level, patient education, motivation and behaviour change guidance, reinforcement of advice and remotivation. Professional guidance in oral hygiene is vital and is effective in reducing plaque levels and gingival inflammation. Clinicians should devote sufficient time to this key stage of the prevention regime and discourage patient self-medication with oral healthcare products in the absence of a diagnosis and professional guidance. Conscientious manual toothbrushing reduces plaque levels and gingivitis, but the ideal brush head design remains unknown. Generally, small-headed brushes with medium end-rounded bristles are advised. Periodontal prevention is a lifelong commitment, and brushing for 2 minutes twice a day is recommended for low-risk patients, but high-risk patients need to spend far longer. Rechargeable power brushes, whilst not essential, are more effective at reducing plaque scores and gingival inflammation than their manual counterparts. But there is insufficient evidence at this time to support one brush design over another. Daily interproximal cleaning is essential for maintaining interproximal gingival health. There is insufficient evidence to recommend the use of dental floss for interdental cleaning in patients with gingivitis or periodontitis. The role of dental floss in daily interproximal cleaning should be limited to situations where the use of interdental brushes is inappropriate. For example, healthy sites with narrow interdental spaces. Interdental brushes are the current method of choice where spaces will accommodate them without trauma, and they provide higher levels of plaque reduction. However, caution is advised in the use of interdental brushes at healthy sites without attachment loss, where interdental spaces may be too narrow to safely accommodate. As an adjunct to mechanical plaque removal, mouth rinses offer additional benefit in the management of gingivitis, as do certain chemical agents in dentifrices. The use of mouth rinse requires additional patient adherence, and thus should be considered on a case-by-case basis.